Hello, welcome to today's presentation, Faster, Safer, Home Sooner, Same-Day Anterior Hip Replacement with Advanced Technologies in 2026, presented by Dr. Alexander Saw, orthopedic surgeon with the Washington Health Institute for Joint Restoration and Research. Dr. Saw serves as medical co-director of the Institute for Joint Restoration and Research and medical director of the Outpatient Joint Replacement Program at Washington Outpatient Surgery Center. Dr. Saw was born at Washington Hospital in Fremont and earned his medical degree, graduating magna cum laude from Thomas Jefferson Medical College in Pennsylvania. He then completed his orthopedic residency at the Harvard Combined Orthopedic Program in Boston, and then the prestigious Joint Reconstruction Fellowship at Rush University Medical Center in Chicago. Dr. Saw was president of the Anterior Hip Foundation in 2022, published a textbook with Dr. Joel Mata, pioneer of anterior hip replacement, in 2023. He continues to serve on the board of the Anterior Hip Foundation and is director of the Traveling Fellowship. He is second vice president of the California Orthopedic Association and serves on many other hip and knee leadership committees. He is widely published and an esteemed speaker and has received numerous awards. Recently, he was recognized in Newsweek's 2025 America's Leading Doctors twice, once as the number 2 knee surgeon and again as the number 21 hip surgeon in the nation. Please welcome Dr. Alexander Saw.
Thank you very much, and it's a great pleasure to be here to be able to talk to you about anterior hip replacement and the advanced technologies which are making this surgery potentially even better with even faster recoveries in 2026, allowing patients to go home same day of surgery, faster and safer, getting back to the quality of life that they want to very rapidly. Just briefly about my background, as you heard, I was born and raised here in Fremont, California, did my training out east and then returned back in 2008, serving as medical co-director and director of the Outpatient Joint Replacement Program since the early 2000s. And this is a picture of my father, who was a head and neck surgeon here for 40 plus years. Again, I was born in this hospital, so very proud to serve the same community that my father did. And while we don't do our work for recognition, obviously it means a lot of us to be able to serve that same community and be recognized by them. And as you heard, it was a great honor and quite a surprise actually this year to be noted by Newsweek in their America Leading Doctors ratings for knee and hip surgery. So really proud for us and our program. We're glad to be able to provide this level of service to our patients here in the local Tri-City area, but also the Northern California Bay Area. Surgeries I do are robotic, total knee replacement and revision knee surgery, partial knee replacement, and what we'll talk about this evening, anterior total hip replacement. We have a focus on multimodal pain management with minimally invasive surgery, allowing patients to go home sooner with outpatient joint surgery and using advanced and robotic technologies in both hip and knee surgery. But first, before we get to that, we need to understand what hip replacement is. In these pictures, you can see what a hip joint would look like. In the top right, you can see what an arthritic hip would look like with the cartilage gone and that red surface, that ball being worn. We remove that ball and then replace it with titanium, a stem that goes into the thigh bone, a titanium cup that goes in the pelvis, and now a new ball and socket. So rather than having a worn cartilage loss on the end of the femur and in the acetabulum, now we have a new ball and socket made of metal, ceramic and plastic that will relieve pain and regain mobility. That's what hip replacement is, and as this animation done really by a child through Play-Doh, it really explains very well what hip replacement is. This is traditional hip replacement, so things like posterior hip replacement or lateral approaches, these are approaches that will cut through muscle. So even in this Play-Doh demonstration, you have to cut through muscle here, cutting through muscle through a mini posterior approach to get to the hip, but there you see exposed is the ball and socket. There, you then replace that ball and socket to restore function and mobility, and that's worked incredibly well for multiple decades. But with this approach, you can see the amount of soft tissue that is dissected. Things have now changed with anterior approach, and I will show you the difference. But this Play-Doh demonstration is actually pretty good and shows how a hip replacement would work with a new cup and a stem put into the femur, so that you have a new ball and socket. Again, these are porous materials, meaning that they're cementless. The bone grows into these titanium implants so that they can potentially last forever. And the bearings now, being ceramic and highly cross-linked plastic, can last really a lifetime, 20, 30 years. And so here you can see with traditional approaches, posterior and lateral and other approaches, you can see that you put the muscles back together, but you can see that to get to the hip joint, you do have to get through that anatomy. What we're going to talk about this evening is anterior approach and what makes it different. This was adapted by Joel Matta, who was a trauma surgeon in Southern California, where doing trauma surgery through this approach, he learned how to do hip replacement through it. So as you can see on the picture on the lower left, it goes between naturally existing muscle planes. So no muscles have to be cut here. You can separate them and go between, preserving that soft tissue envelope, allowing patients to have less pain, quicker recovery, no muscle cutting, improved function, and a more stable hip throughout the lifetime of that hip. It does use a specialized OR table, you can see here on the right, which basically allows the leg to be put in safe positions during surgery to do it in the safest way possible. But this approach potentially allows more accurate and precise implant positioning. This is me with Dr. Joel Matta. Again, I was president of his Anterior Hip Foundation in 2022 and wrote this textbook with him the year afterwards. So here's an example of approaches. You can see typical posterior approaches in red, lateral approaches in yellow. This is how it gets to that hip joint. You can see with the arrows in the middle diagram. Anterior approach in the green on the right goes from the front, but it goes between muscle planes rather than through muscle planes. Because of that, these traditional approaches of posterior and lateral approach really have started to fade away, and anterior approach really has become the most predominant approach in the United States. We'll talk about that more briefly. So what are the advantages of anterior hip replacement? Number one, as we discussed, it is muscle sparing. As you can see on the picture on the bottom right, you can go between natural muscle planes to get to the hip anatomy so that you can do the hip replacement successfully without cutting through muscle. Secondly, you can restore leg length and offset, meaning you can restore the hip biomechanics of the arthritic hip to the natural other side because we have the benefit and unique ability to use X-ray during surgery. So on the top right, you see what a C-arm is, that's fluoroscopy. We can take pictures of the operative hip live as we're doing it to see the implant shape, fit, size, angle, restoration offset, as I mentioned, to make sure that we're restoring the arthritic side to match the opposite side, as you see on the picture on the bottom left. So that's really what we're trying to restore, is the normal opposite side. With anterior approach, because patients are uniquely laying on their back, we have the ability to use X-ray, which you really can't use live during surgery with the other approaches. So that makes anterior approach stand out. That also allows us to have inherent hip stability because, again, we're not cutting through muscle. We're preserving that soft tissue envelope, which gives the hip its natural stability. So patients, therefore, will have less pain and potentially faster recovery. These are the main advantages of anterior hip replacement. Because of that, if you look at the growth of anterior hip replacement, this is a poll of the hip and knee specialists in the US, and what you find is since 2009 there's been a rapid growth, and since 2019, 5 to 6 years ago, is when anterior approach surpassed the 50% mark, meaning over 50% of US surgeons are doing anterior approach. It is the most popular way to perform surgery because of the benefits just described. Now we're going to talk about some of the technologies, and this technology is one that is unique to anterior approach. This HANA table, as I alluded to before, is a specialized table which safely and securely positions the patient and maneuvers the leg so that we can perform the surgery that I previously described safely and precisely. It allows us to access both sides of the hip joint, to do the procedure and to put in the implants while maintaining the most safety for the patient without manipulating the leg and putting them in non-physiological positions like other approaches. So because of that, there's less trauma to the patient when we're using this specialized table and performing the anterior approach. Secondly, we have automated impaction. This is a newer technology to our operating room where it has replaced the hammer or the mallet where we're striking instruments to place the cups or the stems. This gives a very precise amount of power, very consistent amount of power, and we're able to maneuver our hand in position to put the implants in exactly where we want to. So this technology has again replaced things like mallets and hammers where we can put in the implants with even more accuracy. And then this is fluoroscopy. As I mentioned before, fluoroscopy is using X-ray live during surgery. So this machine will allow us to take a picture as we're doing the procedure. So we can see the implant as we're placing it, we can see its fit, we can see its angle, we can see how it's restoring those hip biomechanics. We can take a picture or X-ray of the operative side, but we can also take one of the normal side because it's just across the table. So we can compare the two. We literally can compare one picture to the other and overlay it. So again, this is unique to anterior approach because patients are laying on their back that we can see and take pictures live during the surgery, so we know what we have before that patient even left the operating room. With all the other hip approaches, patients don't get their first x-ray till they're in the recovery room, and by then it's too late to change anything. So this technology has really been helpful in the accuracy of our implant placement and our hip restoration. When you add that fluoroscopy technology to AI technology, here is a technology that will take those images and then do measurements live. So what it will do is it will calculate the anatomy of the patient, how much the arthritic side differs from the operative side. We can do preoperative planning, we can evaluate things intraoperatively, and we can postoperatively evaluate what we've achieved. So this takes those fluoroscopy images and uses AI technology to make measurements, as you can see in the middle picture, to the millimeter in terms of what we restored. And in this video, you will see an example of how those fluoroscopy photos, those x-rays we take during surgery, automatically go into the AI machine, which will interpret those x-rays. They will look at natural landmarks. You'll be able to see the exact angle. You'll be able to see the exact fit and placement and leg length restoration of the hip while you do it. This is again unique to anterior hip replacement when you're using fluoroscopy and using this AI technology. But this is letting us hit the target even better than we could with traditional methods. And as an example, these are pictures. On the left, you can see an arthritic hip with an x-ray in surgery and the opposite normal side. It's always nice to have the normal side to compare to because that's what you're trying to restore. Now, when you do the hip surgery, you can take a picture with the implants in and you can lay it over the arthritic side before surgery to see how much you changed it or where it was. But more importantly, you want to see how your reconstruction matches to their other normal side. So we have this data, we have this information with the anterior approach and these technologies so that we can be as precise and accurate in our hip restorations as possible. We can literally overlay one image over the other. Now, when you look at the literature, what you'll find is when you look at anterior approach versus other approaches like posterior approaches, consistently the evidence favors direct anterior hip surgery for superiority in hip stability and faster recovery. When you look at large studies looking at risks of all revisions and complications, what you'll find with anterior approach on the left, lower rates of all-cause revision, lower rates of dislocation or stability, lower rate of readmission, lower rate of fractures. So actually many benefits of the anterior approach compared to the traditional approaches. And when you look at patients, here are patients who are now able to go home hours after surgery. You look at these two examples, they just had surgery a few hours ago. And here's an example of a patient who went home
my name's Sean,
same day.
And today I had an interior hip replacement by Dr. Shaw. And I'm going home today, pain-free and walking out of here. Very grateful. Thank you, Dr. Shaw.
So this is what anterior approach and advanced technologies can do, and it's amazing to see people restore to their quality of life even sooner, as you can see in that video. The benefits again of anterior approach are essentially no risk of dislocation, no limitation on hip range of motion on positions, no restrictions after surgery, less reliance on assistive devices, less pain, higher function, and faster recovery. The technology is really changing how we're doing surgery. The advanced technology in hip replacement, as we've reviewed, is improving our surgical accuracy and our precision. It's changing the way we think and perform hip replacements. It's letting us hopefully provide even better results with superior outcomes and faster recoveries. The demand continues to grow for these advanced technologies, both by patients and by surgeons. It continues to evolve and improve, and we're constantly improving the technology that we have to bring good outcomes for our patients. Only certain surgeons and certain centers have experience with robotics and advanced technologies and anterior hip replacement, so certainly do your research to see who is using the most advanced technologies and procedures. This is all leading to outpatient joint replacement. As you saw in those prior videos, it is now routine for people to go home the same day as hip replacement. This is not your mother's or grandmother's hip replacement where people are in the hospital for 2, 3, 4 days. They can now go home in 2, 3, 4 hours. We started the outpatient joint replacement program here in 2015. We were one of 2 in the country when it first started, and we've been happy to lead the way and teach others how to have a successful and safe outpatient joint replacement program. Again, this is that same patient doing his other hip side, and here's an example of an 82-year-old woman just 2 weeks after her anterior hip surgery on the top. And then this right is a great email I get, a patient the day after they go home from surgery. She sends me this video and just wanted to show me how she could throw her cane away and walk safely in her own home. the morning after surgery. So this is how things have really changed to get people to feel better, home safer, home faster, enjoying their life even quicker. So again, this is why we do it. It's all about the patients. We're very appreciative of patients telling us their stories, how they get back to their way of life. This bottom right video you will see is a gentleman after hip surgery who decided to go skydiving. I wouldn't even do that, but it's great to see what he can do. Or people who are doing incredible weights at the gym, or even water skiing 6 weeks after surgery. It's incredible to see what people will do, but it always thrills us for when we get these notes from our patients and we can see that they're living the quality of life that they want to after a successful anterior hip replacement. So with that, I thank you very much for your attention. Feel free to learn more at our website listed here, and we'll look forward to meeting you someday. Thanks so much.
Thank you, Dr. Saw. We have a few questions. How do patients manage pain at home after the procedure?
With our minimally invasive techniques and with the anterior muscle sparing approach, pain is really not what it used to be. It is often quite well controlled with simple things like Advils and Tylenols, over-the-counter medicines. In addition, I do use some advanced medications that I can use during the time of surgery, where I can apply it to the surgical site, so nothing systemic, nothing they have to take later. It's at the surgical site under the incision, but it elutes out pain medication for over 72 hours. So it can relieve pain locally, making it that people don't require opioids or oral medications. So hip replacement often is not very painful, so people can recover often with just over-the-counter medications.
Can a patient expect to be able to walk again right after the surgery?
As you saw from these videos, people can walk, either with an assist device and sometimes even without assist device, just hours after surgery. So people will go home. You saw the 82-year-old who at 2 weeks was using no assist device. So you can ambulate immediately. To leave the hospital or the surgery center, you have to be able to walk safely and to manage stairs. So those are discharge requirements. So yes, people can ambulate right away on a new hip replacement.
Does a patient need to do any physical therapy or have any follow-up care after they go home?
Physical therapy is not required after anterior hip replacement because hip replacement tends to heal itself. It tends to auto-heal, if you will. So just by walking and doing natural activities, people will tend to recover well. They do not have to do formalized or organized physical therapy. Doing their own activities and their own walking will naturally rehabilitate the hip.
Thank you so much. This concludes our program. Thank you, Dr. Saw, for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on YouTube.